Well, Pune's water scare is raising tough questions. Residents in several areas have reported foul-smelling supply and lab tests have flagged bacterial contamination. Civic teams are testing pipelines and asking people to stay cautious. At the same time, doctors are also tracking a cluster of neurological illness cases. Health officials say some patients had recent gut infections and surveillance is now expanded across Pune and in the nearby zones. Experts also say the real concern may actually lie underground. Aging pipelines, pressure issues and gaps in expanding neighborhoods are being examined as possible weak points in the entire system. This, remember, comes just weeks after the Indore contamination crisis, where unsafe water triggered widespread illness and a major probe into civic oversight. What is going wrong inside urban water networks and how do cities really prevent the next scare? Joining us this morning, Subrata Chakraborty, Director, Water Program, CSER Center for Science and Environment, which is a leading policy research and advocacy initiative focused on sustainable water and wastewater management. Good morning, sir. Also with us is Mr. Vishwanath, as founder and director, Biome Environment Solutions, who for years is focused on water literacy and sustainable sanitation. Mr. Subrata, if I can come to you first, we're talking at a time that this conversation has been ongoing. Remember what happened in Indore? That, of course, made it to headlines, and so we saw a lot of follow-ups. What about what we're witnessing in Pune? How concerning is this? Water contamination in several locations, Mr. Subrata. And the authorities are now acting up. But the fact of the matter is, and the worrying part of the story is, that this sewage water has already found its way into people's homes. It's too late by the time authorities wake up.
This is very alarming. Good morning for having me. So this is very alarming. And this is not a case of one city, two cities. This is happening across cities, across states. It clearly indicates that our system for sewer network and drinking water lines are failing, systematically failing. And this is also indicating that we need to closely check in what is happening underground. So when drinking water contamination is happening, we need to understand that contamination is happening because of wastewater, that we are failing to manage our wastewater. So managing wastewater is the key principle for having safe drinking water in our cities. So this is one. And it is also not that our engineers do not have guidance from the government of India. So in terms of guidance, we have manuals and policies that clearly indicates how sewer lines and drinking water lines to be put in place underground. So the policy clearly says that you first have drinking water line and below that you have sewer lines, right? So that if there is any leakage happens, that sewage from the sewer lines do not enter the drinking water lines. But underground situation is very difficult and different. So there are small and narrow lanes, and specific to Pune case also, this is happening in narrow lanes. So and also the manual says that you have to maintain a lateral distance of 3 meters and a vertical distance of around 0.5 meters. So the standard slightly differs from the two manuals to manuals, but mostly this is the standard.
Yeah.
But because of the space paucity, because of multiple issues, the city engineers may fail maintaining those things, right? So there could be departmental coordination issue. There could be issue of getting the maps underground. What are the pipelines crisscrossing each other?
Yeah.
So the things need to be checked in. And also the manual clearly says if there is a crisscross happening, if these two pipes crossing each other, then what are the precautions you need to take? Now, these cases coming of the cities clearly says that these are not, happening. Operation and maintenance part is not happening. In this case,
does the problem, Mr. Chakraborty, lie in the operation and maintenance part primarily, or the manner in which the pipeline network has been established because of possibly an overwhelmed urban infra? Not sure if that really is the reason in a city like Pune. We're not talking about Delhi or Bombay, but your analysis.
So in both ways, one is part of the planning and management, planning and designing of this. Now, Pune was around a 31 lakh population in 2011, and currently the population could be anything between 70 lakh to 80 lakh. Now the city population are increasing. Now our sewer lines and drinking water lines are not designed for managing such a huge population.
Yeah.
When the population increases, there is pressure on the drinking water line and the sewer lines. So you need to, push more water, maybe safe water for the drinking water line, wastewater for the sewer lines, to push more water into those pipelines. And when you sporadically add geographical areas to this network, so this inherently creates some problems, some turbulence within the pipeline. So designing is definitely, urban expansion designing is definitely a part,
Yeah.
because historically our cities are not planning for accommodating new areas. They have been reacting to the new situations coming to their planning periphery.
And that is actually the underlying problem, that we're more reactive in our approach than actually forcing, let's say, how the water supply systems are looking like across cities for the next 20, 30 years, or maybe 50 years for that matter. That's how future-proof the system should be. I want to bring in Mr. Vishwanath into the conversation. Good morning,
Sure.
Mr. Vishwanath. Sewage found in drinking water across many locations. Let's start with basics. How dangerous is this situation from a public health standpoint? The sound of it is very worrying, but what more is happening here? To what extent are things going wrong?
It's very serious. It's very alarming, very concerning. And it's a known fact that because we don't have pressurized 24/7 water supply in our pipe networks, that sewage intrusions get in. However, if we do not take adequate precautions, we'll be faced with public health calamities, which can be very, very severe.
Mr. Vishwanath, Mr. Chakraborty just highlighted the basic design, infra-related problems. How does sewage enter drinking water pipelines? Let's decode that further. So from your experience, what are the most common technical failures? Is it pipeline leaks? Is it cross connections? Is it pressure imbalance, or just poor sewage network maintenance?
Well, it's actually a combination of poor water network maintenance and poor sewage network maintenance. Typically, the one weapon that civil engineers have from a public health perspective is to ensure something called residual chlorine, which is chlorine at the end of the pipe at the consumer level, which should be roughly between 0.2 to 1 part per million. If we keep track of this chlorine, residual chlorine, and make sure that the water supply system has this residual chlorine, then we will not face any contamination impacts from bacterial and viral contamination. But we fail to do this. We fail to ensure residual chlorine at the consumer level.
Okay. Mr. Chakraborty, let's talk about people who are suffering as a result of mismanagement on so many levels. A lot of times, unfortunately, we've seen that, your high-rise buildings, your secure societies, localities, typically have access to clean water. So they may have in-house filters, they may have an entire process that benefits them at the end of the day. It's these rural clusters or, areas that are not really given too much attention that end up bearing the brunt of unhygienic water or sewage water mixed in their water supply. Don't you think that's also a clear pattern?
See, if you have a purification mechanism, definitely your chance of getting contaminated reduces. This is one. But at the same time, we need to understand why majority of cities are failing, right? So many cities are dependent on the groundwater sources also. There are tube wells and bore wells. People also based their water from there. And in case of Pune, there are many, so a couple of hundreds of borewells and these dug wells people uses, right? And the exact number is not possible. There are several numbers coming from. Now, according to municipal records, the municipality Pune is now covering almost 95% sewer coverage they have, Pune. But they also said that there's 65% of the sewage network, 64% sewage they capture, which means around 30% of the sewer wastewater that the city generates is not being captured and not in treated.
Yeah.
Pune, there are multiple small channels of water. Those are feeding the river, Mulamutha River. You will be surprised to know that these rivers are at least 2 lakh years old, and this city is at least 800. The city habitation started growing from 8th century, so it's an old city, old river network. Now, what happened that we are extracting water, we are using it, and then we are releasing to the environment. So this is polluting small river channels and river work. And when we are polluting this, our lakes and water bodies, everything is polluted.
Yeah.
Now the people who are dependent on the tube wells and wells, they are also consuming this water, and so the chance of contamination also
Yeah.
increases there.
So can decentralized wastewater treatment or let's say local water management reduce risks like these?
Yes, a decentralized wastewater management can reduce this, but this comes with caveats that has to be properly monitored, right?
Yeah.
So because decentralized treatment system means you needs to have decentralized governance and monitoring. Unless this is infrastructure creation is one part of the thing, but the rest of the managing of the treatment system means it's a strong governance.
Yeah.
Now, when we have bigger infrastructure, we thought as a governance that we will have a lesser effort in managing say X number of things. If we multiply X number of solutions into say 5x, 4x, nx, then our responsibility increases. So monitoring comes as a major chunk.
Yeah.
So for wastewater that is coming from the the habitations, if those can be locally managed, locally treated, and after treatment, the treated water can be reused for recharging. So this always helps our groundwater and also surface water bodies to
And we do have the entire rule book, Mr. Chakraborty. The unfortunate part is follow up and maintenance, and like you said, it's that one stage where we're failing at, and
Yeah.
that's really turning the picture against us overall.
Yeah.
Mr. Vishwanath, let's talk about early warning systems as well. What modern technologies, let's say pressure sensors or leak detection or smart metering, can prevent sewage contamination, and how reliable can these sensors be? Can we actually hope from this kind of an intervention from early warning systems?
Pressure sensors can definitely help, but basic attention to regular maintenance is crucial. We need to make sure that we have a system of constant tracking of residual chlorine that I mentioned, and that the feedback from the labs is quickly communicated to the field for action to be taken to plug leakages. We must also make sure that we hear consumer complaints very quickly and respond very quickly. There should be telephone lines available, free toll numbers, where people can respond with a particular pollution impact that they face, and that should be responded to. If we get these basic system right, then the sensors will help us to make sure that the system becomes fail-safe.
Yeah, even in the case of Indore, that's exactly where things went wrong. We saw how authorities did not act in time. It's only when your hospital numbers go up is when people start paying heed to what really is going wrong on ground. Mr. Vishwanath, you've long spoken of decentralized wastewater treatment, and I just asked Mr. Chakraborty the same. Do you think localized treatment can reduce risk of contamination in cities like Pune? What are your thoughts there?
Well, unfortunately, decentralized systems will work best in a formal planned colony. Most of India, urban India, is unplanned and irregular colonies, right? In these kind of layouts, unplanned settlements, it's very difficult to put in place pipelines which do not touch water lines, for example. So we need to focus on the basics and then work on decentralization at appropriate scale. And the basics are formalization of the city, planned city growth, and making sure that water networks and sewerage networks cater to 100% universal connections.
Again, the challenging part there, Mr. Chakraborty, will be urban planning. Already you have cities established. How do you then go about a revision in your underwater pipeline network? So what are your thoughts there? What kind of what kind of water systems should we ensure are part of our everyday in these metropolitan cities, and how can we revise that entire structure? How can we redo it and really plug in on all that's gone wrong the last few years?
For Pune, as a specific example, the city authorities knew that their sewer network is aging, the drinking water network is aging. So they were saying that around 10%, 1/5, around 30% of their network need to be replaced, and around 60 kilometer needs realignment. So this is the interaction we had with the municipal authorities. We understood. So it's not that city authorities do not know that their system is aging, there need to be replacement. And also the fast sewer network and drinking water network came in Kolkata around 1870, and after that, so it's more than 150, 60 years of time that we have been building drinking water networks. So around 5,000 cities we have in India, right? So almost all the cities have drinking water network. So I can give you a guess figure, around 10%, around say 500 cities out of 5,000 cities have sewer network. It means majority of the cities already have drinking water line, and now we are moving towards laying down sewer networks. And the manual says that sewer network should be below the drinking water line. So it means for the engineer, when they dug the land, they have to identify the drinking water line. They have to go below, they have to maintain the distance, and then have to put up the sewer lines. So this is an engineering challenge. But fortunately, we have now new technologies. With the technologies and capacity building, the city engineers can identify the drinking water line, so they can replace the drinking water line. So this is one part of it. Another part of this is that we have many informal settlements in the cities, and the number is there also in Delhi and also in Pune, in all other cities. And these cities, these pockets are very interesting. These pockets, they may not have a proper drinking water lines, they may not have a proper sewer lines, right? And the problem starts from our household, our toilet. Now, flushing and forgetting is a common phenomena across class and creed in India. So be it high class, be it low class, we flush and forget what happens to the fecal matter, right? So this is basically going to a containment structure. We see the polished, white, beautiful front end, the commode we use, but after that, this is going to the containment structure. This containment structure is faulty in multiple cases. It happened in Indore that the containment structure is set up just before the drinking water line. So because we don't know what is there beneath the ground, right? And this is the problem. And our masonry system across cities, is they are poor.
And to make it worse, to make matters worse, Mr. Chakraborty, you have unpaid dues in this case in Pune of over 930 crore rupees. So how is that going to help a situation that's already out of control? Mr. Vishwanath, your thoughts, can unpaid bills cripple water safety, and to what extent? So when utilities don't recover costs, what corners are typically cut first, and how does that impact, let's say, maintenance or sewage treatment or basic upgrades?
Absolutely right. So the gorilla in the room, or the elephant in the room, is pricing of water. Water is a human right. It should be made available free of cost to those who cannot afford it, or at least at costs which are reasonable. But beyond a certain limit, water should be priced so that the municipality or the institution which is providing it has enough funds for operations and maintenance. And that's the most crucial component of a water supply network, making sure that the systems are robust, that the chlorination levels are good and correct, that pipes don't leak, they don't rust, and that sewage water and drainage water is not picked up in the pipe network. And that will start when there is fiscal responsibility, but also institutional responsibility to make sure that water safety plans are in place.
Okay, that's all the time we have. Unfortunately, we're not going to be able to touch upon the cities that possibly are getting it right, Mr. Chakraborty, but that's a conversation for later, and hopefully people will pick on what's happening in Pune and really act in time so we can prevent what happened in Indore not too long ago. Thank you, gentlemen, for joining us this morning.
Thank you.